Welcome, everyone, to our discussion on the future of public policy in a longevity society. As people live longer, our focus must shift towards ensuring that our lives are not only longer, but also healthier and more active. For decades, economists have warned us about aging societies. Globally, falling birth rates and rising life expectancy are reshaping our populations. For instance, in the United Kingdom in 1951, in 9 people was over 65. Today, that has grown to 1 in 5 and is expected to reach 1 in 3 by the end of the century. There is a common belief that a growing older population means negative economic outcomes, such as higher healthcare and pension costs, lower GDP, and increased tax burdens on a shrinking workforce. Yet, if we look back over the past 100 years, the proportion of older people in England and Wales increased almost threefold without directly causing economic disaster. The key is not merely having more older people, but in changing how we age. Consider that in 1922, a 20-year-old had a 1 in 5 chance of living to 80. By 1972, the odds improved to 1 in 3. Today, a typical baby can expect to live into their early 90s. Looking ahead, our challenge is not about supporting a larger number of older people, but about ensuring that the young and middle-aged become the healthiest older generation ever. This is the concept of a 3-dimensional longevity dividend, where we extend not just life, but also health and productivity. A crucial change will be supporting longer working lives. Governments are already attempting this by raising the state pension age, yet that alone does not ensure people remain productive. We need a suite of measures, including healthcare support, lifelong education, flexible working arrangements, policies to tackle ageism, and retirement planning linked to healthy life expectancy. Our healthcare system also requires dramatic change. Currently, it is set up to react to diseases after they emerge. Since most common conditions such as dementia, cancer, and diabetes are linked to aging, it is vital to focus on maintaining health for a longer period, rather than treating diseases as they occur. Shockingly, only around 1% of health budgets currently go towards prevention. Governments must increase public spending on preventative health, harness artificial intelligence, and embrace personalized genetic testing. Additional investments in public health initiatives focusing on diet and activity, along with robust research in geroscience, are essential. One of the greatest achievements of the last century was reducing mortality risk so that most young people can expect to reach old age. However, if we fail to invest in our future, an aging society burdened by diminished health and productivity may emerge. On the other hand, if we make our longer lives healthier and more productive, we can reap a substantial economic longevity dividend. We have long understood that investing in the health and education of the young drives economic growth. As life expectancy increases, the same holds true for older ages. It is time to wake up to the reality of a longevity society and to invest in a future where longer lives are also healthier and more productive. Thank you for watching and for joining us as we explore this vital topic. Let us work together to create a future that not only extends our years, but enhances our quality of life. Stay informed and proactive about building a better, healthier future for all.